Hey, welcome back. Okay, so if a patient hasn't committed to care in the report of findings meeting, they usually call back. And when they call back, we take their payment over the phone, schedule their first session, and get them in the building as soon as possible. And usually people do that if they haven't paid for the program when they're in the office. They do that within 2 days, so we usually see them a couple days later. In the first session, the technician has a script, which is below, that she shares with the person what the session is going to be like. And there's also a video on my YouTube channel of what to expect in a neurofeedback session. So you can go there and you can look at that, or you can refer to that for your patients. But basically, she's not telling anything about the care because our technicians are not allowed to. She's just telling them about the process, and really it's rapport building and helping them feel comfortable. They're always in an individualized room on the first session so that we can give them that amount of love. And after the session, we tell them that there's the clean windshield effect, so it may make their brain feel better. And optimally, if they're able to take a nap, we recommend that because their brain just got a workout. Okay, that's the first session. When a person comes back for their second session, we review the first session graph with them. We don't do it on the fly at the time of the first session, and really that's for two reasons. One, scheduling. So when the person's first session is scheduled, a lot of times either mine or my husband's schedule is full, so it's difficult to, on the fly, make time in our schedule to go talk with them. We can definitely usually do that. On the second session, we prioritize it. So what happens is then on the second session, they come in, and on the iPad and sometimes on the computer, we'll show them that first session and briefly tell them how to interpret the lines, how it correlates to their map. And really all we want to tell them is your brain had an awesome response to training. See how it started here, and we have this downward trend. Your brain is already starting to change. We're really happy with this response to training, and we give them a few specifics. That's the important thing. And number two, we don't do that on the first session so that we have time to look at it so that we can prepare what we're going to say to them. So especially if you're at the beginning stages of interpreting trend graphs and you don't feel uber confident, then you want to give yourself a one session time frame or a couple days to be able to look at that graph and to be able to come up with your interpretation of it so that you can share it with the person. If you're a newbie, sharing it on the fly can sometimes be very stressful, and you may not have anything good to say to a person. So on their second session, you interpret their first session graph and tell them you'll do so again in 7 sessions. Okay, stay tuned because we'll talk about the 7 session visits in the next lesson. Thanks.